Combination of the Delta variant and a low vaccination rate is fueling a surge of COVID cases in Alabama. Alabama is the least vaccinated state in the country. Just 34% of its total population is fully inoculated. On Wednesday, the state's Department of Health reported an average of more than 1,900 new infections per day. Hospitalizations are also rising. According to AL.com, Alabama's third COVID wave is officially its second biggest and getting bigger. Ramsey Archibald joins me now with more on his reporting. He's a data reporter for AL.com. Ramsey, welcome. Thanks very much for being with us. So Alabama saw high case counts last summer and over the winter. Can you put this current wave into context for us?
Sure. So, like you said, the case counts now are higher than they were in July of last year. That was the first real surge we saw in Alabama was last July. And at the time, we thought it was a 4th of July spike. And we're sort of operating under the same assumptions now, except for cases are higher now than they were then. Today, they crossed the 7-day average for new cases, crossed 2,000 for the first time since February of this year. And cases this winter were still much higher than they are now. So we're not quite to that level yet, but the ascension, so the curve is very sharp right now. So we're seeing really fast increases in case counts.
Yeah, we see how steep that curve is. We saw that in that graphic a moment ago. Ramsey, what do we know about the patients who are currently hospitalized?
So we have quite a few patients hospitalized. I think the last number was over 1,200, which again is not quite as high as it was this winter, but it's still very high. And we're seeing the average age of patients hospitalized with COVID-19 in Alabama get younger. So whereas last winter, I think the average age was about 65 years old, that has come down now to about 55 years old for the average COVID-19 patient in Alabama. And there's a couple of reasons for that. For one thing, even though Alabama has very low vaccination rates, the people who are most likely to be vaccinated in Alabama are older people. So 65 and older they have much higher vaccination rates than the rest of the state, that's part of the reason we're seeing that age come down, but also because Delta is just so transmissible and people in Alabama are living life as if there's no coronavirus right now.
Well, what challenges, I mean, you touched on it there, what challenges are local health officials reporting as they try to care for an increasing number of patients?
I mean, one of the biggest challenges we've seen is trying to convince people to get the vaccine. And there is some good news on that front. Just in the last week, we've seen an uptick in people initiating a vaccine series. So getting that first shot, really the first uptick we've seen since the very early stages of the rollout. It's still not great numbers, still last in the nation, as you mentioned, but that is a good sign. And there's been a lot of misinformation about the vaccine, and then there's distrust about masking and mask mandates. So there's a lot of trouble getting the message out to people.
Yeah, and it was really interesting because against that backdrop, we saw Republican Governor Kay Ivey with some pretty forceful words for the unvaccinated. Let's go ahead and listen to some of that.
COVID-19 virus is being driven by the unvaccinated. My message remains clear and simple. Everybody in Alabama ought to get can get the vaccine, ought to get it.
So, I mean, you pretty much answer this. The vaccination rate, you said, has picked up just a bit for those looking for that first dose. Is it clear, why? Do we have any sense? And is it misinformation primarily as to why the state ranks last in the country?
I can't say for sure whether, Kay Ivey's comments or what spurred this latest increase. I think likely it has something to do with the rising cases, right? So if most of the spring cases were down, so people thought, oh, I don't need to get it. There's no pressing concern right now. And that has clearly changed in the last month. We've also seen a big push, not only from Kay Ivey, but from other lawmakers in Alabama. Republican Senator Tommy Tuberville came out with a pro-vaccine stance within the last couple of weeks, and that's been pretty common lately here. Misinformation is definitely plays a part in why people, I think, aren't getting it. You can just read my email inbox if you want some of that. But I don't think it's the only reason. I think there's obviously a lot of real concern about the safety of these vaccines for a lot of people. And I think the lack of overall healthcare in Alabama. So a lot of people here don't have a regular doctor that they would go see and can ask these questions to. So I think getting people the information they need from a trusted source will be really key going forward.
No, that's a really important bit of context, Ramsey, because I think, for people in other parts of the country who do see a primary care physician on a somewhat regular basis, that may not be something that factors into their understanding of why it is other people would choose not to get that vaccine. If you don't have someone who's trusted in the medical profession to ask, then you can see how perhaps misinformation might persist. All right, Ramsey Archibald, thank you very much. Really appreciate it.
Thank you for having me.